Good morning, Dr. Ritu.
Good morning. Am I audible?
Yes, ma'am, you're audible. You need to turn on your camera.
Am I audible? Am I visible?
Yes, ma'am. Ma'am, I would just request you to kindly put your mobile on a landscape mode.
The landscape mode, like this?
Yes, ma'am, little upwards. Put it
Little
little
up.
upwards. Yes, it's not covering your head part.
Um,
Yes,
Wait.
ma'am. Fix it there. Yes, it's perfectly all right.
Is it now good? Is it good now?
Ma'am, little more up.
Just wait. Just wait. Mm, okay. Can I borrow some moments, please?
Sure, ma'am.
Is it good now?
Yes, ma'am. Perfectly all right. So, ma'am, we have Dr. Sushil Vijay, sir, our orthopedics guru for the session today.
Hello, sir.
So, hi Ritu.
Hello, sir.
Many
Hello, sir. Good
congratulations on the
evening. Good
success.
morning. Thank you, sir. Thank
So,
you.
अभी घर पे तो पार्टी माहौल है बिल्कुल.
Yes, sir.
Okay. So, Rinsi, are we ready to start?
Yes, sir, we are good to go.
So, Ritu, first of all, a big congratulations from all the
Thank you,
DBMCI
sir.
family members, and thank you so much for making us so feel so good that when the students are getting success, we feel so honored, and it feels like कि हम ही लोगों का result आया है. No, again we are on to the counseling session और फिर से सब शुरू हो रहा है. We'll be on to the classes, so it gives us a very good feeling. So many congratulations to you and the whole family. So,
Thank you, sir. Thank you.
Ritu, was this your first attempt?
So, my first attempt was just after my internship. In fact, just before my internship got completed in 2020, 31st March. So, practically first honest attempt and otherwise second attempt.
Then improvise. Basically, that was a trial kind of thing. Okay,
Yes.
so let me tell everyone that she has scored rank 166 in the, you can say, first serious attempt, we can say that, right?
No, so, sir, actually, I wrote INI-CET in November also, and that was my first serious attempt, but I could not, get rank as per my expectations in that.
So what was the rank that time?
So it was 1765 that time.
Oh, that's a huge jump. From the 4-digit mark to almost close to 2000, you have come almost to, less than 200. That's a wonderful achievement in itself. So everybody who is watching this interview now, and I would just like to say one line here, that those who are messaging me or any of the faculty, sir, this was my first attempt and I was not able to make it. My score went to 5,000, 6,000, 10,000 or 2,000, let's say. So she is here in front of you. An example, the one you can use to motivate yourself, you can see these toppers and they will definitely, their journey is definitely is going to guide you to get some good ranks in the upcoming exam. Okay, so Ritu, you were a foundation batch student, if I'm not wrong, from
Yes, sir. Yes, sir. Yes, sir.
So now I want you to tell us from the beginning how this journey started. in the college, and then with DBMCI, and then till here, INI-CET. To you now.
Yes, sir. So I'm foundation batch student from Merit Center, and it started a long back. Like we were in third year, we were not that serious. We were just like other students only, sir. I would like to emphasize this a bit more. We were just like other students only, sir. And we used to attend classes, but we used to, run away in between. Sorry to say that, sir, but we were having that kind of
life, huh?
Immature kind of mind.
That's a typical medical college life.
Yes, sir. Yes, sir. So we used to attend classes. We used to make notes, but they used to be incomplete. Sorry, sir. But so then eventually we entered internship. After doing all those struggle and attending all those long classes, we eventually entered internship. But in internship also, I was like, ki bahut mehnat karni padti hai, because I used to see people around me, they were really putting very solid efforts into their studies. They were doing their duties and studying a lot more than me. So that thing, settled in my mind कि बहुत मेहनत करनी पड़ती है, and I just regarded myself as कि मैं नहीं कर पाऊंगी this इतनी मेहनत. So I used to enjoy also. I had that kind of mind कि अभी let's do masti, and later on we will study after the internship is completed. So I studied in internship, but not that much, not that seriously. I completed a few of my subjects also during my internship only, like short subjects I had completed. I used to read my notes, but I was a slow learner. So whatever I could finish, I finished. I finished my 10 subjects. So I gave
during
my NEET
internship.
exam. Yes, sir. 10 subjects during my internship, and I did not attempt MCQs, but I used to give GTs during my internship, and that thing really helped me, because after giving GTs, whether you are getting ranks or not, that is not the thing which should be considered, but the thing that you are giving GTs, so you are knowing what kind of questions are asked basically from that topic. So I got fair idea about those topics during my internship when I used to attempt GTs. I would mention this fact that I had given more GTs during my internship than this attempt. So it might be a controversy, but this is a truth, sir. So because during internship days, you are less afraid of failing. So you can attempt the paper as you like to do it. So in this year, I was more afraid, sir. So internship helped me in that way, that I used to give more and more GTs, and used to read my notes at my own pace. So I could finish few subjects, and then when I completed it, I gave full time to my studies. So eventually that step ladder approach completed, and I could finish my syllabus and revise it.
So now you are here with rank 166. Okay, yes. So some of the important points for all the students who are now taking these students, these superstars as their inspiration are, see, when I'm talking to Ritu, I can just point out a few important things. Number one, the most important thing she is saying is about the notes, right? You made your own notes. That's the most important thing. She has emphasized more on that. She has been running out of the classes, incomplete classes. And then that's okay. That's absolutely fine, because, that's a typical student's mindset. And those who feel like, or those who say that only the college toppers can crack the AIMS exam or the PGI or the JPET, it's not like that. It's about how smartly you are planning your things. Right? So she has been running. She accepted that. That's wonderful. That's kind of...
No, sir. I would like to intervene in between. Some of my friends might say this fact. So I'm telling that during my first and second year, I have a gold medal also.
Oh,
so,
that's wonderful.
Yes, sir. But after first year, second year, I got really exhausted, and I felt like puri zindagi padna hai. So I became a chill out person in my third year and fourth year and intern. So this was my journey, that I was serious in first 2 years and not after that, but a bit less serious after that.
But post internship, you had done a lot of hard work.
Yes.
Yeah. So important things, again, the notes, she had maintained the notes. That's a very important thing we can catch from her words. Second thing is she completed 10 subjects doing her internship, right? So internship period has been very, very important for everybody, those who are giving exam this year in 2021 or those who are planning to give the exam in 2022. Because, you know, from 2023, it is expected that the next will be coming and the exam will be held not after your internship, before your internship, right? So what I can feel is with Ritu, there was a, you know, one added advantage that she was having a year of internship with her.
Yes, sir.
So she could chill out in the third year, she could chill out in the final year. Internship maybe thoda bahut kiya, but she did completed 10 subjects in internship. So those students who are, you know, preparing for the upcoming examination must see this thing, that making notes is very important, whether you are targeting your NEET or next or anything. Second, revising your notes is very important. Don't run to, you know, thousands of sources ki yaar baad mein kar lenge. It's not like that. You have to have your own set of notes which you can, you know, revise at the last moment. They will save a lot of time, right? So GTs, one most important thing she said is she gave more GTs during her internship than this year when she was going really for the exam. Okay.
Yes, sir.
So Ritu, what I feel when you are going for the GT exam, obviously first few GTs are not very good, right?
Yes, sir. Yes, sir. I started with 130 correct.
130 correct only. So that was a very less number.
Out of 300.
Out of 300, only 130 correct. So less than even 50-40%, I would say. So that's absolutely fine. You know, everybody who is watching this video, you have to realize when you talk to these toppers, when you talk to these, you know, gold standards now for the days. So when you talk to all of them, you can realize one common thing. What is that? That they started somewhere giving the test. Whether the subject, what do you say, Ritu? If some student asks me often, sir, I have not yet, you know, completed a particular subject. Let's say ortho is not complete, anesthesia, medicine is not complete, and there is a GT coming. Should I go for that or no? What do you say?
Yes, absolutely. Absolutely. I did not do any subject and I went for GT and I analyzed from where the journey is supposed to be started. You need to get that fact correct in your head from where you are starting. This is really very essential. And no matter what you score in GTs, you never know what you can get from the universe at the day of examination, which is the most important. And so I would like to tell you that this was my best rank ever. Matlab, I never got this rank in my GTs. I was in 500s, 600, 400, but not in top 200. So you never know what the universe is planning for you. So have faith, I would like to say. When my result came, my friends actually told me, I'm really blessed to have friends like them. And I'm really thankful to them for supporting me in whole of my journey. But their call came. I was about to sleep ki aaj to nahi aane wala, kal subah dekhte hain. So they called me and told ki itni rank hai. First I told them, are you pranking? No. Are you making my fun? So no, they said, no, it's true. I cross-checked my roll number multiple times that it's my own only.
So the best score this time in the 8th exam.
Yes, sir. So the thing is, you never know what you can do at the day of examination until you do it and have faith. So,
no doubt. I absolutely agree with you. So don't think about the result. Keep on doing your preparation. So Ritu, when you were giving that test, when you were, completed your 10 subject in the internship, when you were giving, you might have given subject-wise tests also, the GTs also.
Yes, sir.
What was your method of, improvising your notes or improvising your way of remembering the things which helped you out in this exam? What was the way you were studying?
So, I used to give test. I used to, first of all, analyze my wrong questions first. Because if you spend time from first question to last question, you will never reach your wrong questions. There is high chance. So first of all, just go through your wrong questions and analyze those questions and those topic first. And then you can go for your right questions as well. If you have ki tukka lag gaya, so you can go for them also. So, and attempt your GTs in multiple ways. You might attempt all 300. When I started, it was 300. In some GTs, you might try for 160 correct, 170 correct, whatever suits you. Just, try in those GTs itself. Some people might say that you should attempt maximum number of possible. If that works for you, it's really fine. But some people might try a conservative approach. So you should try your own approach. You should not follow anybody blindly. So if you, like some people say, do not watch a video repeatedly. So, but I was a good listener. I knew this fact that I was a good listener. And if I follow somebody else's strategy that do not watch videos multiple number of times, that might not work for me. It worked for them. So everybody is a different person. So you may see one video multiple number of times at 2x also. When faculty emphasizes the question, that used to get in my head, more quickly that rather than doing questions my own self. So I used to watch videos more because faculty has fair idea of what has been asked, and they usually underline the thing, and they usually emphasize that 2 or 3 times. So that really gets cemented in your head after listening so many times. If you're a good reader, read your own notes multiple number of times. So you should analyze your own self. It's about reading the things. It's not like some formula, mathematical formula, which has to be applied as it is. It is about you, your experiences, about yourself. So do not follow anybody blindly. I would like to say this. So
it is basically individual,
yes,
individual,
sir.
you can say capacity, whether you're a good listener, you are a good reader,
Yes, sir.
you can
Yes,
sit for a
sir.
long time,
Yeah.
So
Yes,
that's
sir.
a
Yes, sir.
fantastic thing you said. So don't follow
Yes, sir.
anybody blindly.
Yes, sir.
Find
Yes,
out
sir.
that what you are good in and do that.
Yes, sir.
Okay.
Yes, sir.
So
That's
Ritu, you are coming from a batch, the batch which
2000.
has seen, the NEET exam separately, AIMS exam
Yes, sir.
separately, JIPMER separately, PJ separately.
Yes, sir.
You have
Yes,
given
sir.
an exam in a period where there is a need and where all the 4 premier institutes have clubbed together.
Yes,
and
sir.
you are guiding all the students who will be giving probably all the institutes
Yes,
merged
sir.
together.
Yes, sir.
What exactly is the difference you feel when you join the foundation batch? You might have taken certain classes, right?
Yes,
Like
sir.
the first, second year classes. And now
Yes,
when
sir.
you
Yes,
have
sir.
come up to the, to the test series, then you might
Yes,
have
sir.
find out that when you are sitting in the test and discussion, the faculties are now more focused on the integrated approach,
Yes,
right?
sir.
So
That's
you are
difference.
coming from a period where you have seen a simple class also. You are coming from a period where you have seen the integrated classes also. So I want to know from you, what exactly is the difference you felt as a student and you would like to convey to your juniors to read in a more integrated approach, starting with any of the subject that you like the most.
So about integration, the thing is, if you know your contents well, if you have read subject wise also, and if you know your content well, you can integrate in whichever possible way it is asked. So there is not much difference that questions are integrated. So you can leave this book and try some other books where questions are merged together. It is not like that. If you know something, you will integrate. Your mind will tell you that this is the topic. This is the topic which is being asked. So there is no other way. You should read subject wise first only. Like you should make your concept stronger in each and every subject. And when you will read it second or third time, you will eventually realize that your mind is integrating by itself. You need not put any extra effort to integrate if your content is strong, sir. So and GTs also have good number of integrated question. You can try out that, and you will eventually realize that all those long questions arise only from one fact only, which was asked as a single liner, and now it is multiple histories given just to confuse.
Basically, a factual question being converted into a conceptual question.
Yes, sir.
Right?
Yes,
so
sir.
Basics have to be strong.
Yes, sir.
Okay.
Yes, sir.
Second thing, often the student what they're asking me is, sir, अब जरूरत क्या है ना first second year subject की, अब तो सीधा final year पढ़ लेते हैं.
No, sir. No, sir. This is a huge mistake that you can commit in your exam, sir. Because what I feel was my first year and second year subjects, which are usually volatile, were stronger. So that really helped me, sir. So make your first and second year stronger. That can give you extra edge, because final year, everybody studies in final year, in irrespective of the medical college which they are in. Everybody studies in final year. So the thing is, all of your competitors might have stronger final year subjects. But if your first, second year and mini subjects and short subjects are stronger, you can definitely have an extra edge. Do not leave. In fact, my strong points were first, second year subjects and short subjects. So, okay. So I was weak in final year subjects. I mean, not weak. I mean, those questions are really confusing. You never know what the answer is, what the answer examiner might be liking in that situation, which is being given in that question. So it is like that, sir.
How about your internship period, Ritu? You were reading from 10 notes. What about your postings, clinical, life, the hostel life,
so
and
I used to
hospital? You used to go to the wards and all?
Yes, sir. Definitely. I used to go to wards, sir. In fact, I should not say that I did not have a cooperative group. So
Okay.
I used to go to wards and my posting, and few of my friends really helped there, and some did not, like usually in all the medical colleges. So I used to attend my posting. I was a day scholar, sir. I was not a hostler. So I used to daily travel to my college and return back to my home. So yes, I did my posting nicely, wholeheartedly, sir.
So basically what I feel is for the INI exam, what impression it has given to us is that all the time it will be a clinically oriented exam. But this time it was a more of a kind of simplified things. So now this exam has given us an idea that only not the clinical part, the theoretical part has to be collaborated with the clinical part. It's not only the
Yes,
clinical
sir.
or the theoretical. It has to be a
Yes, sir.
club part, right?
Yes, sir.
Okay.
You need not revise like catheters, cannulas. You have seen it. You have, put cannulas and catheter. This is what usually interns do in peripheral medical colleges, collecting the sample, putting the cannulas. So
All the time,
their
yes.
colors. Yeah, like they are just nightmares to a cannula catheter.
Yes. So basically,
So
what you're
do
saying, I absolutely agree with that. And that's
Yes,
what I
sir.
tell every student, that questions are everywhere. You
Yes,
don't
sir.
need to mug them up. You just need to see them. You're
Yes,
using the
sir.
cannulas, you're using the Foleys, you're using the ETs, and the numbers given behind them, every bit
Yes,
of
sir.
detail behind them. These are there for a reason. And
Yes, sir.
AIMS is all about a reason, right? So
Yes,
wards
sir.
are full of questions. The hospital, the medical college is full of questions. Only you have to have the eye and the brain to just see it, right?
Yes,
Okay.
sir. In fact,
So
biomedical waste also, sir.
yeah, it
So
was a very important topic.
I used to be really conscious कौन सा किस में डालना है. So in my posting, so that way it was easy to remember. So, मतलब few of the topics
When
you
you
can,
do, when you're doing in daily life, then you remember it much better.
Yes, sir. Yes, sir.
You know?
Yes, sir.
So
Yes.
Ritu, one message that you want to convey to everybody who was not able to make this time, because this was your third attempt, second serious attempt, so one message to all those who were not able to make it this time, and to the ones who are preparing to give it for the first time, both the categories of students.
All the first timers, sir, I would like to say you really have that edge of being fearless. So you can, take advantage of your fearlessness, and you should try your best. I think if I had read all the subjects, instead of just 10, and not got influenced by so many people around me, I could have made that. I feel, I'm not sure about it. Maybe I could have made that in that attempt only. So all the first timers, read all your subjects. Do not skip any subjects, because from all the subjects, few simple one-liner questions are always asked. If you can grab all those questions and make them correct, so you can make a huge difference in your rank. So for the first timers, I would like to advise that please be serious in your attempt, or you never know what you can do until you do it. And for all the repeaters like me who could not make it in this attempt, I was like you in the last exam, and I know how it feels when you have put all your heart and soul into something and you do not get your desired rank. You do not feel like talking to anybody. You just feel like crying, and you just ask, what is my fault? But eventually when you get something which you did not even think of, then you will realize that it was not your fault. You were destined for something else, something really beautiful. You might not realize it this time. I was like कि मेरी last attempt में 200 under 200 तो वैसे भी नहीं आती sir. So it might might have landed it to 1000, but it could never have been 200. But this attempt I tried a little harder, so I could make it to this rank, sir. So please don't get disheartened. I was at your place. I know it is easier said than done, but please put your whole heart into your
again.
Notes. Yes, sir.
Yeah, it is not
and
the end
try.
of the road.
Yes, sir. NEET has such good colleges. You cannot, say that some college is bad or good. I don't feel like that. NEET has such good colleges. You can learn from things from there also. So please put your heart and soul, and you never know what you can do. Please do this.
So everyone, you just don't have to be disheartened.
Yes,
getting
sir.
the result is not in our hands, but improvising ourselves is definitely in our hand. And if you are honest with yourself, if you are putting your heart and soul into it, don't worry. Things might take some time, but they will gradually come to you.
sir.
That's for sure.
So I would like to add one fact over here. Like some of my friends and even me, we all were affected in COVID time. So we all lost our 1 month of preparation. None of us could focus because a few of my friends lost their near dear ones, and our families also got affected really. But do not take that load. Do not walk with that load on your heart. You can, you have read your things well. It's just about revising. If you put 1.5 months and 1 month of preparation, you can really revise well your notes. Do not think like I have forgotten everything. When you read notes, the content is so much that you will feel like that you have forgotten. It's you bounded to have that feeling. But when you sit in a test, you will realize that 4 options are there, and you can maybe eliminate, you can guess, you can make some intellectual guesses, and you will you can.
So basically, all about is nobody can actually read 100%. That's a fact.
Pardon, sir. Pardon, I could not hear you, sir.
I am just saying that it is a fact that nobody can read 100%. This is a fact.
Yes, sir. Yes,
everybody
sir. This
was
is
affected
a fact.
in COVID.
Yes, sir.
That is also a fact. Everybody
yes,
has
sir.
to be on the same page, and everybody is on the same page. That is another
yes,
fact.
Sir.
But yes, your hard work is never, it will not be wasted any time. It will. It is bound to give you some good results. Maybe
yes, sir.
sometimes slow, maybe sometimes very fast. But yes, it will give you the result. That is for sure.
Yes, sir. Yes, sir.
Right.
That is for
so,
sure.
Ritu, it was very nice talking to you. And I do believe
sir.
that all the students who are preparing for the upcoming examinations will be taking all the important points that she has shared. She has been very good in her first and second year, gold medalist. Third, final year, some chilled out life, like every medical want. But then finally, internship, the hard work started again. The smart work started again. She analyzed in the first attempt what exactly the exam is about. She gave an honest attempt in November, got not such a good rank, but this time she cracked it, right? So this is an honest journey of an honest student, what I can say, who has done everything in her life. I could say, enjoyed the medical college, enjoyed the medical life, studied well, smartly, hardly, and now a wonderful result.
So I would just like to thank Almighty. So Almighty has given me the things which I never ever thought about, and my parents for supporting me. So it is really difficult to be a aspirant after graduating. So it is really difficult. So I would like to thank my parents and my really my dearest of friends, guys. This is because of you guys. You were always there. I'm blessed to have you. I'm really blessed to have you as my friend, sir.
So party diye bhi friends ko ki awaited hai abhi?
Yes, sir. Party done.
Party done hai. So enjoy, yes, Ritu. Enjoy, and best wishes from whole DBMCI family to you and to your family too. Sir. And I do believe that you'll keep on shining. You'll keep on getting successes like this in life, right? So keep excelling, keep doing the best you can, and our best wishes with you. Right?
Thank you, sir. Thank you so much, sir.
Thank you, Ritu, for taking out time to talk to us and for guiding all the juniors.
Thank you, sir.
Thank you so much.
Thank you so much.
Thank you, Rinsi.